Yeah. Thank you for asking.
My name's Katie. I'm going to be your medical assistant for today. We're going to head down to the pool. Right. You can see whatever you like, okay? I cleaned everything off for you. It's good to see you, though.
Yes.
I know it's been a little bit since hard to get in the office, so I'm glad you made it.
Yeah, I almost wasn't able to make it today. They purposely sent the transportation to the wrong address.
Did they really?
Yeah.
So who are you getting transportation through? Is it through your insurance?
Yeah.
And their cars aren't really that clean?
Yeah.
Have you ever tried like Uber or anything? Is it too expensive?
No. So what they do is, if, like for example, they were supposed to pick me up today at 2:15 p.m. and 2:17 p.m. they didn't arrive. Okay. So I called them. I said, "Hey, I'm calling about reservation number 109697 or something like that." I have it documented on the email, and they said, "Oh yes, let me check on that for you." They said, "Okay, let me call the transportation and see what their ETA is." So I waited. It took about 15 minutes for them to get back on the line. When they got back on the line, they said, "Oh, they said the transportation company said they don't have your information in their system." I said, "Well, that's impossible. They sent me a reservation number." And they said, "Okay, well, we'll just dispatch an Uber or Lyft for you." I said, "Okay, can you make sure you do that right now so I don't miss my appointment at 3 p.m.? And they said, "Well, we can't guarantee that right now." I said, "What do you mean you can't guarantee? I have transportation scheduled at 2:15.
Right.
It's 2:43 p.m. right now. I need you to dispatch an Uber or Lyft immediately," which is what they usually do.
Right.
And I said, "Okay, I need to speak to the back office and tell them to dispatch." I said, "Okay, can you please hurry up?" And then they got back on the line. They said, "Are you able to go there at 3:45? Your appointment? I mean, could you be late and go to your appointment at 3:45?" I said, "Yeah, I'm sure I could, but I need you to dispatch the Lyft or Uber right now."
Right.
And they said, "Well, I'm not sure if we could do that." I said, "Yes, you can do that. They've done it before." And they said, "Okay." And then they sent me a text message saying they're sending an Uber or Lyft at 3:45 p.m. And then on the same text message, they sent it to the wrong address.
Of course, right? That's what happened.
Court. And so I was literally on the phone with them, and I said, "Well, you just sent it to the wrong address." And I literally had the front office here at FSU Primary Health on three-way waiting for them to answer the phone so I could let them hear the transportation on the phone telling me that they're
gonna be late.
Yeah, and that they sent it to the wrong address.
And
then and then the person on the phone from transportation at a call center that was being outsourced in the Philippines, she says, "Well, I don't know if we could send it right now." This, that, and the third. He said, "Well, I have your address. I don't know why they sent the wrong address on the text message." I said, "You're lying." And when I hung up the phone, that's when they sent me this text message immediately after, saying that there's a Uber or Lyft arriving in 4 minutes. Right. So I clicked on the map to see where they were, and I called the driver.
Mm-hmm.
I said, "Hey, they sent you the wrong address. I can't miss my appointment. It shows that they're telling you to pick me up from the neighborhood that's adjacent to mine. So could you just go to the next neighborhood over and pick me up?"
Mm-hmm.
He said, "Okay," and then he picked me up.
Good.
And I don't know what they had going on, but dude had on like a earpiece, like he was from the White House or something.
Sometimes they do that. I think it's like that way they can talk to people on the phone, which is really rude when you're driving someone around without having a phone in their hand.
Yeah, I mean, from a security perspective, I could care less if they're doing that. You know, acknowledging that they're doing that for my best interest, but they don't need to sit there and make me feel like I'm going to be penalized if I miss my appointment, I'm not going to be able to go to a nutritionist or occupational therapist or what's the other thing I requested?
I think it was
pain management.
Okay, pain management.
You know, all those things. So it really aggravates the situation. It makes it much worse because, for example, yesterday I was just picking up my laundry bag to take it upstairs to wash my clothes, and when I walked back downstairs, the back right side of my neck, I felt a sharp pain, and it was hurting really bad.
Okay.
And that same sharp pain keeps going away and coming back. And
right, which is what we had talked about kind of last visit.
Yeah, and that's the main thing. Like, you know, I need to see specific specialists. I need to go to a nutritionist to make sure I'm eating the right food, because if I'm eating the wrong food, you know, it could possibly trigger an infection and then make the pain worse in those areas. That, you know, doctors don't really usually tell people that type of stuff.
Right.
And then, you know, I need to see an occupational therapist because I'm trying to
and see what referrals we had put in. So it looks like we put in a referral for a nutritionist.
Okay, great.
We put in a referral for an occupational therapist and a pain management.
Okay, good.
So we have all those referrals, and we also have a referral for nerve conduction. And I'm not sure if you had gone to that yet, but
yeah, I did a nerve. What was it, EMG?
Yes, it was a weird kind of thing that they did.
Yeah, they put needles in my neck and my arm, but it left large bruises all over my neck and my arm.
Really?
Yeah.
They used little baby needles too, right? It's interesting that it left the
bruises. They were really long and thick.
Right. Interesting. I didn't know that it was like that.
Yeah, and it left. I took a bunch of pictures. I called the neurologist's office. I told him to make sure not to delete any records.
Right.
You know, and I sent them the pictures of the bruising, and you know, just to make sure, you know, if anything goes wrong, at least it's documented that I called them and told them not to delete any records, just in case they think they might be sued for medical negligence or malpractice. But you know, I'm familiar with these types of problems, you know, and I'm trying to avoid anything getting worse because I need to fully recover. And you know, the way the pattern that's forming, it's as if, you know, they're purposely doing things to make sure I don't fully recover, and that's a problem.
Right.
You know, and
well, you know us. We'll take care of you. We'll figure everything out. Okay.
Yeah. So I mean, at the end of the day, I need to go to a nutritionist. I need to know what foods I need to eat. I need an occupational therapist because I'm trying to get my law degree, my medical degree.
Very
so I'm assuming if I go to an occupational therapist, they'll be able to do some kind of therapy with me in the sense of, you know, the field that I'm going to be working in.
Right.
You know, whether they're going to be strengthening the muscles in my body for the, you know, those specific areas in my body where I'm going to be utilizing those muscles for that specific field that I'm going to be working in, and the pain management aspect of it.
Right. So, finding ways how to cope with that pain that you're having.
Yeah. So those three specialists are very important.
So I do want to talk a little bit about any physical things that have changed since your last visit. So I know that we were talking about some chronic back pain that you were having, some chronic neck pain that you were having. How are those two things going? Are you still in a lot of pain?
Yeah.
Yeah? And have you been trying anything else to make it a little bit better? You haven't gone to any therapists, correct?
No, Dr. George Whitten, he mentioned something on the portal about if I think it's responsible for him to refer me to a nutritionist, occupational therapist, and pain management after I missed my doctor's appointment.
Right, because
I didn't know what to tell him, you know, and because I already reported to him why I missed my doctor's appointment, so I didn't want to be rude and just repeat myself and, you know, answering something he already knows is kind of rude, you know, because I'm not a doctor, so he knows better than me. But so I just didn't say anything, and I just tried to go to my appointment again. You know, once again, I continued to try to make it here.
Well, like I said, we're really happy that you made it in today, but sometimes those referrals that we send out, they need like a physical exam or something, and we hadn't seen you in a while. So we'll get that all fixed today. We'll check everything out, make sure you look good. Dr. Will take an exam on you, make sure everything's good, that we need to send out those referrals, okay?
Yeah, and I noticed there was blood in my toilet after I used the bathroom.
Okay.
And I don't know why, but there was blood in my toilet, like around the, you know, where the water settles inside the toilet.
Mm-hmm.
Where the top of that where that water settles, it's red, like there's blood.
It's red.
Yeah.
And is that the only toilet that you use?
Yeah.
Do you clean it often? I know that you had a cleaning service coming out to kind of help you out managing your
Yeah,
your...
but I need a referral for that though.
You do, really?
Yeah, because I when I called the cleaning service, I had to pay out of pocket.
Right, I saw that. I saw your messages through the portal.
And it's kind of expensive
it
for
was
me.
Expensive.
So if I get a referral, that'll help.
Okay. So is it okay if I take some vitals on you?
Sure.
All right. Vitals. Blood pressure here. All right, just relax that in. And then I'm gonna put this on your finger. Blood pressure looks good. It's a little bit elevated, but that's pretty normal. Alright, and do you have any other concerns that you want to bring up physically before I go out to talk to Dr. Whitten?
I'm trying to remember. There's so many things I needed to mention.
Let me see if I can go through some of your patient cases here. It looks like your left shoulder was hurting, your back was hurting from throwing some trash out.
Yeah. Yeah, I really need a referral for a home healthcare aide.
I did see that as well. Let me add that in there. So typically those people are able to come out mostly just a couple times a week, maybe 2 to 3 times a week. So it's not like everyday care.
Well, if they could at least help me throw out my garbage,
Okay.
and for example, help me clean my bathroom, and maybe throw a few loads of laundry in the washing machine and dryer, that helps a lot.
Okay. And I know last time that you spoke to Dr. Whitten was over that telehealth visit, and we sent you a psychiatrist referral just to go and talk to them. Did you ever end up talking to them?
He mentioned that on the that same narrative on the portal.
Right.
When he was asking me if I think it's responsible for him to send me a referral for the nutritionist, occupational therapist, and pain management after I missed my doctor's appointments with him. I haven't called them.
Okay.
Only because I didn't know what to think after reading that, and I didn't want to be rude. I didn't want to call them and then without talking to him first or whatever the situation is.
Absolutely, which is another reason why it's great that you came in. We can talk about it.
Yeah, and another thing too, they wanted me to complain about Dr. George Whitten. They wanted me to report him for not giving me the referrals.
Who wanted to?
My insurance company. But I told them I'm not gonna. I told them that I'm not gonna report him.
Okay.
Because I know how it feels when somebody retaliates against somebody.
Right.
And
well, the only reason that he probably didn't submit those referrals was just because we hadn't seen you in person for a while. So maybe today we can talk about a little in depth about getting those referrals done. But it does look like you ordered them. So I'm gonna have you fill out these 2 papers here. There's another one underneath it, and I'm gonna go outside. I'm gonna talk to Dr. Whitten, and then he'll come right back in. Okay.
Okay.
Sound like a plan?
Yeah, good. Do you mind just filling this out for me? Just asking me the questions. I'm an expert on it.
Okay. All right. So the first page that I have here is about anxiety and depression. So I'm going to go through this. You tell me 4 answer choices. The first one is not at all. The second one is several days. The third one is more than half the days. And the fourth one is nearly every day. Okay? Have you had little interest or pleasure in doing things?
Yes.
Okay. More than half the days, several days, nearly every day.
Every day.
Every day. Feeling down, depressed, or hopeless?
Every day.
Trouble falling asleep or staying asleep?
Every day.
Feeling tired or having little energy?
Every day.
poor appetite or overeating,
Every day.
feeling bad about yourself or that you're a failure,
Every day.
trouble concentrating on things such as reading newspaper or watching television,
Every day.
moving or speaking slowly so that other people can notice, or the opposite, being so fidgety or restless that you've been moving a lot more than usual.
It all depends on the situation. I mean, just like you can see now, I was eager to get here. They sent the transportation to the wrong address, and then going back and forth trying to schedule transportation and sending unsanitary transportation and making me sick, me having to go to the emergency room. It's just an ongoing problem. So it depends on the situation.
How would I fix that one?
Sure.
Thoughts that you would rather be better off dead or hurting yourself in some way?
No.
Alright, and this one's for anxiety. Have you been feeling nervous, anxious, or on edge?
Every day.
Not being able to stop worrying or worrying too much?
Every day.
Trouble relaxing?
Every day.
Being so restless that it's hard to sit still?
No, not so much.
Okay. Becoming easily annoyed or irritated?
Every day.
Feeling afraid that something awful might happen?
Every day.
So that's the first one done. The second sheet here is for any symptoms that you've been experiencing. So I'm going to go through them. You tell me yes or no if you've been experiencing them, okay? Fever.
Yes.
Weight gain or weight loss?
Yes.
Have you gained weight or lost weight?
Both.
Okay. Vision change.
Yes.
What's been happening with your vision?
I'm noticing is sometimes my vision will be blurry.
Okay.
Yeah, sometimes it's blurry, and I'm noticing that there's like a white pus in my eyeballs. I need to go to the eye doctor.
Any problems with your ears, nose, or throat?
Yes. I ate some hot dogs yesterday.
Okay.
And I noticed I started feeling some ear pain, and I started breaking out on my face really bad. And I didn't feel that pain, and I didn't break out before I ate the hot dogs.
Okay.
They were the ballpark hot dogs, 100% beef from Publix. And I ate them with some Nature's Own hamburger buns.
And then you kind of started feeling like you were breaking out and your ears hurt?
Yeah, my ears started hurting. I started noticing like right on my earlobes, on both sides, it started feeling like there was an infection starting to build up there, like an abscess. Okay. And then I noticed there's like an abscess right above, right in between my eyes, and on my chin. Okay. That formed literally the next day after I ate the hot dogs, and underneath my neck.
What about any chest pain or shortness of breath?
Not really shortness of breath, but it felt like something was like wrong with my stomach really bad.
Okay, have you been getting abdominal pain? Any nausea or vomiting or diarrhea?
Nausea, yes.
Okay.
When I was brushing my teeth and my tongue, I threw up.
Okay.
What else? I'm trying to remember. Something's wrong with. Oh yeah, and I also noticed after I ate the hot dogs, I started. They tasted like cigarette butts.
Really?
Yeah.
Interesting.
Tasted like cigarette butts.
Okay. What about any
No, I don't smoke cigarettes.
Right. So it's strange taste.
Yeah.
What about any differences in your urination?
I noticed. My mom told me to drink some turmeric, lemon, and ginger.
Okay. And
heat it up in the microwave with some hot water.
What was that to help with?
She said it's like a medicine, and so I drank it, and then I went to the bathroom. I had a bowel movement like 5 times within 1 hour.
Okay.
A lot of it was just water, and then some clumps after a lot of water, and then I felt much better. It was like a miracle. Like I haven't felt that good in a while.
Good.
And then I noticed my urine was really clear after that. And,
Right.
and right before I drank the lemon, turmeric, and ginger, my urine was really dark and it had a weird smell to it.
Interesting.
Yeah.
Do you think you're drinking enough water?
I don't know. I think I am. I drink a lot of water and milk and stuff like that. But it had a really bad smell. It smelled kind of like fishy a little bit.
Interesting.
Yeah, and but when I drank the lemon, ginger, and turmeric and the hot water, it was like night and day. It was amazing.
But you're not having any pain when you go to the bathroom when you go pee?
I noticed it was burning a little bit after I ate the hot dogs.
Okay.
But before I ate the hot dogs, it wasn't burning.
Good.
Like I would literally be sitting on the toilet, and then I'd be like trying to push out whatever little feces is left in my stomach, and some urine would come out, and it would feel like it was burning a little bit, but not like a really bad burning, but it was like a burning sensation kind of.
All right. Well, I'm going to tell Dr. Whitten all of these things, okay, and we'll talk about it. For now, I'm going to have you step on my scale real quick. I'm going to enter your weight, make sure you haven't lost enough pounds or anything like that. Are those your shoes that you wear all the time?
Well, yeah, these are my house shoes.
They look pretty comfy.
Yeah.
Alright. 217.6. You did lose a little bit of weight since our last visit in January.
Yeah, that turmeric, lemon, and ginger helps.
Alright, so I'm gonna go outside, I'm gonna talk to Dr. Whitten, and then he's gonna come in and talk to you, okay?
Thank you.
Hello.
Dr. George Whitten.
So good to see you face to face again.
Finally, right? They tried to make it. They tried to make it mission impossible for me to come see you today.
All right. So they send a relatively clean vehicle for you this time.
Yeah, but they sent it to the wrong address. They sent it to the wrong address, and then on top of that, they tried to convince me that they sent it to the right address, right? And literally when immediately after I called them a liar, and I hung up the phone, they dispatched a Lyft, and they sent me the text message saying it's going to be there in 4 minutes. But literally right before I hung up the phone and called them a liar, they said they're going to send a Lyft at 3:45 p.m. and if I could be late to my appointment. I said, I'm sure I could, but I need you to send a Lyft right now. My transportation was scheduled for 2:15 p.m. I called at 2:17 p.m. because the transportation didn't arrive. And they're telling me they called the transportation and they don't have my information in their system. So I'm like, okay, well, that's not my problem. Send an Uber or Lyft because I can't miss my doctor's appointment. And they said, well, I don't know if we could send an Uber or Lyft right away. I said, yes, you could. They've done it before. And they said, okay, let me contact the back office and tell them to send an Uber or Lyft. I said, okay. And then about 15 minutes later, they get back on the phone saying, they're asking if you could be a little late to your doctor's appointment. I said, yes, but I need you to send the Uber or Lyft right now. And
well, you actually got here not pretty close on time, didn't you?
I think it was about 3:06 p.m.
Yeah.
But I literally had to tell the driver to drive to the community that was adjacent to the one that they sent him to. And he was hesitant to do that. And I had transportation who was at a call center overseas in the Philippines on three-way with me trying to call the doctor's office here to tell them that they sent the transportation to the wrong address. They're telling me that they're going to send it a little late.
All right.
You know what I mean? Because
anyway, that's all water under the bridge now. All right, so here's the thing. This is what I've been trying to get across to you for a long time. You finally, after many missed attempts, were able to get the nerve test, and all it showed was that like mild ulnar neuropathy in the left arm. So, which is good. It didn't show a lot. It doesn't mean you don't have pain. It just means you don't have, the nerve and the spinal cord aren't being pinched. If you get a lot of muscle spasm, it may irritate the nerve then. But as far as the anatomy and the physiology, it's not as near as bad as it could have been, which is good. But my opinion, the first order of business, and we try to get it set up, and Stephanie Nolder, our licensed clinical social worker, sent you some information where you could do online video visits with mental health persons, so you don't even have to leave the house. Because we have to figure out some way to make it more likely that you will keep appointments before I set up all these appointments. Because otherwise, the only way we can even see you here is we double book you every time. And now that you finally showed up, I have 3 people here at the same time. But normally people get fired after 4 missed visits. But I know that if you don't show, it's okay because we already have someone else booked. But other people aren't going to do that. And so we're trying to get you set up to see these other people. We got to make sure you're going to make it there. And you get this mesophobia, germophobia is just so powerful, you end up missing all these visits. And I don't know if there's a way to fix that, but I think that, talking with a mental health person would be helpful.
Yeah, I'm sure if I explain to them, the clear and convincing evidence that I've already accumulated about them sending unsanitary transportation vehicles time and time again, and the vehicles really being unsanitary, visibly unsanitary, and to the extent where it's making me sick and I'm having to go to the emergency room, literally right after doctor's appointment.
Right, but see.
But what I'm saying is I'm almost certain, and I'm saying I'm almost certain that by them documenting that, it'll push them to make sure that they don't do that again. Because me just reporting that to you, it didn't help.
Well, I don't know that anybody has control over these Lyfts and Ubers where we can dictate.
So they have transportation companies that are contracted with Humana Motive Care Transportation, and they're telling Humana Motive Care they're telling Humana, who's paying them to transport patients to and from doctor's appointments, that their vehicles are sanitary. They're telling them that their vehicles are safe, and the vehicles are not going to put the patient at risk.
Right.
But they're lying. And, I have clear and convincing evidence proving that time and time again, that it's happened several times. Literally during, before, and after my doctor's appointments, they would dispatch, before and after doctor's appointments, they would dispatch unsanitary vehicles. And, they wanted me to go as far as complaining about you because you didn't send me a referral to a specialist. And I wasn't going to do that because I'm witnessing the pattern that's forming. And the pattern that's forming is they're trying to use a situation and they're trying to manipulate it to have somebody to blame for their faults. You understand?
Mm-hmm.
You're here dealing with, I'm assuming several hundreds of patients, throughout the week, for example. You can't be, expected to be, focusing on every single little detail. That's why they have the different departments within different health insurance companies. Like, for example, they have Motive Care Transportation that's contracted to Humana to make sure that, they send transportation to the doctor's appointments and they follow policy and procedure. So, in all those different contributing factors. So
whenever you get these vehicles that show up that, in your opinion, are dirty or filthy or toxic, are you taking pictures of them?
Yeah.
I don't need to see them. I'm just curious because now look at it from my standpoint.
Right.
The first time and the only other time I saw you face to face, when you left, you immediately came back in thinking that you had contracted COVID immediately after getting into a vehicle. That's not possible. Okay, so some of this is psychosomatic.
I think it might have been
psychosomatic, right?
I think it could have been what they call it, reactive airway disease. Because I felt similar symptoms.
Yeah, but you weren't wheezing when you came back in. Now, had we documented that, that would be something to go on.
Yeah. I felt hot. I felt my body felt much more hot than it was before I opened the door and told the driver I'm going to have to dispatch a different vehicle.
Right.
And I started feeling sick internally. Like for example, when I was breathing through my nose, I noticed the air was a little hotter than it was.
Yeah.
I started feeling sick throughout my body. So I was assuming that it might have been coronavirus.
I need mental health to help you understand that a large part of this is psychosomatic. It's like way over-exaggerated what it should be.
I think they're calling me now. Hello, this is Omar.
Hi, Omar. This is Jeanette, your Lyft driver.
Hey, Jeanette. Yes.
Hi.
Are you here?
Yeah.
Okay. Could you wait about 15, 20 minutes?
You'd have to call in to schedule that.
Okay.
Because he had me picking you up at 3:45.
Okay. Yeah, I should be done in about 15, 20 minutes. If you need me to call.
Schedule that with Lyft then.
Okay. Thank you, ma'am.
Yeah. You're welcome. Bye bye.
Mm-hmm.
All right. So
don't worry about that.
Do you need to put in a call for another Lyft?
Yeah, I want to show you this. This real quick. I don't know what happened to it.
So look up here while I see. So
unless I'm breaking out. So I ate some hot dogs.
Why would you? You're so scared of toxins. Why would you eat a hot dog? That's the nastiest thing on the planet.
It said 100% beef. It said it was Ballpark brand. I thought it was a good brand, and it tasted like cigarette. But yeah,
no, it's just that hot dogs are just stuffed full of fat. They're just unhealthy. They're like sausage. I'm not saying they don't taste good.
that's the vehicle they sent to bring me home from your doctor's office.
You don't have a seat cover or something?
Yeah.
And that's disgusting.
Yeah, it's kind of nasty looking.
You don't never have me want to.
Floorboards is pretty clean though. Does that look fresh or is that just stained?
I don't know what it was, but I wasn't about to find out and sit on it either.
It's probably stained. But
Thank you.
yeah,
Yeah, it looks like dry blood.
I appreciate it.
it could be anything.
It's dark brown.
Yeah,
I appreciate it. Thank you.
I think I would put a dark seat cover on there.
And then look at this. The transportation company is called Faith Transportation. Traveling by faith.
Traveling by faith.
Like, that's insane. And then when I went inside and complained to you, and then look at the vehicle they sent after that. They sent a brand new vehicle, a brand new orange truck. Look at the difference.
Yeah. Too bad they can't do that every time, huh? All right. So whenever you get one of these spots on your face, how are you treating it?
The Dr. Ira Freilich, he told me to get the Panoxyl face and body wash.
Mm-hmm.
He said to get a 2 to 5%. I couldn't find one. They had a 10%. So I'm washing my face and my body with the 10%, and it's working perfectly.
Mm-hmm.
But the problem is, it's like $10 for a 5.5 ounce bottle, and I literally need the whole bottle every time I shower. And I notice when I use the whole bottle, and I'm proportioning it from my face to the middle of my body to my private parts to my feet, and I'm changing the rags. Like, for example, I use a rag for my face, a rag for my private parts, and a rag for my lower extremities. It clears up literally after the first time I use it. But if I'm using the same 5.5 ounce bottle just a little bit, and using the same rag, for example, for my face and my body, it doesn't work at all. So, it's expensive. And but he mentioned, though, that there is something similar that he could prescribe. I think it's called hibiscus cleanse or something like that.
Hibby cleanse.
Cleanse.
Chlorhexidine.
Yeah.
I've tried to prescribe it because you can buy it over the counter and use it, insurance won't cover it.
Could we try?
Yeah, we can try to look up and see. But a lot of times I've found that they won't cover it since you buy it over the counter. It's what they use when people can't use betadine because they're allergic to iodine. They'll use that to clean before surgery. So it's a good antibacterial. But you probably don't really have to use something like that all the time.
What I noticed was I bought like
chlorhexidine.
5 of the Panoxyl face and body washes, and I literally used a full bottle, a full 5.5 ounce bottle, for several days in a row every time I showered, and it was like I didn't have a blemish on my skin from the head to my toes. But the day that I didn't use it, I started noticing the blemishes were coming back slowly, and I told my mom, and my mom said drink some lemon. She said put a half a lemon and get an equal sized piece of turmeric and ginger, peel it, put it in some boiling water, and drink it. And I did that, and I literally had a bowel movement 5 times within 1 hour, and I felt incredible after that. And
you had a purge.
And it literally, as soon as I drank it, for example, I drank it while it was still hot. My entire chest was on fire. But then I put it in the freezer, I let it cool down, and I drank it some more. And when I drank it, the first sip of it while it was cool, I felt like my body was just brand new. Like I felt like this jolt of just freshness go through my entire body, like I was cured instantly. I never felt that feeling before.
What's the name of the stuff that you were buying over the counter, the 5.5 ounces?
Panoxyl face and body wash. It's a 10% benzoyl peroxide face and body wash, foaming face and body wash. It works really, really good. I mean, if anybody has any kind of blemishes or anything like that, tell them to drink some lemon, turmeric, ginger, and hot water, and use that Panoxyl face and body wash, and use a clean rag for, their head, their private parts, and their lower extremities. And I think it works just as good as surgery.
Yeah, sometimes we can get that. Well, now the benzoyl peroxide's over the counter too. Yeah. So have you tried using just dial soap?
Yeah, I tried dial soap, but it didn't work for me.
Because I was going to clean this later on here.
I tried dial soap, but it didn't work for me too good. I noticed the best soap that worked for me was that Canasta.
Yeah. So how's the left arm been doing lately?
It's still the same. It's going numb. My hands and arms keep going numb. I'm noticing that while I'm just holding the phone and talking on the phone.
Mm-hmm.
Whereas like yesterday, when I was trying to lift up my my laundry bag to go upstairs and put it in the washing machine and dryer, when I walked back downstairs, I felt a really sharp pain on the back right side of my neck. It was hurting real bad.
So when you're dealing with your laundry or when you're taking the garbage out, you thought about just separating the smaller size containers so you're not carrying so much at one time?
Well, what I started doing was, instead of, like, for example, accumulating so much garbage,
Right.
I kind of tried to downsize because it was also costing me a lot of money purchasing all those items.
Right.
So I stopped eating food. It's kind of just like fasting
Right.
and trying to
one wash it out.
and just trying to minimize the amount of times I'm having to wash clothes and shower and all those things.
Right.
And I'm noticing the less food that I'm eating,
Mm-hmm.
the less dirtier I would feel.
Mm-hmm.
And it helped. I mean, I didn't have to wash clothes as much. I didn't have to shower as much. I didn't have to throw the garbage out as much.
Right.
So
do you, other than that, what's the word I'm looking for? I can't think of the word I was looking for. Brief departure from sanity when you ate hot dogs. You normally eat pretty healthy food.
yeah, well, I was eating fish and fruits and vegetables and things like that.
Good.
But then I don't know why all of a sudden I felt like my blood sugar was low or something, and I had a craving for something sweet. So I bought some of those cinnamon rolls, the from Costco where they make them in the bakery. I felt normal after that.
Yeah.
Then all of a sudden I had a craving to eat some hot dogs for Memorial Day.
Right.
And
Actually, I had hot dogs on Memorial Day too, but that's a rare thing for me to eat a hot dog because I know what they're made from. I mean, they're sterile, but they're just full of fat. Squeeze my fingers really hard. Okay, good. All right. And then pull my hand towards your shoulder. And then this side, pull. And can you bring your arms up like this? And hold them, don't let me push them down. Hold them. Yeah. And you push
hurt
down.
my left shoulder.
Yeah.
And then also my ring finger on my left finger hurts. Right here in the middle where the bone is. Hurts.
It's actually sore in there.
Yeah, it feels like a sharp pain when I squeeze that area there.
So
Hurts right there, too.
this is the nerve that has that little bit of entrapment. And whenever it's like, they call it a funny bone because this is the humerus, this bone. But that nerve comes down here and gets this finger and half of this one. So if you like had your arm like this for a long time with the elbow bent, it puts a little pressure on there. Like I used to sleep like that, and I'd wake up with this part of my arm dead and this finger. If you ever feel that, you can feel this one's dead, that's dead, but that's still alive because it's a different nerve. If you ever feel that, that's that nerve that showed up on that test. All right, so let's see. Bring this hand over to this shoulder and hold it right there. Now try to push my hand away with your hand. Like to try to push my hand. Does that?
It's hurting the left side of my neck.
Okay. And then let's bring this over here and then there and then rotate this way. And push against my hand. How about that?
It's a little bit of pressure there on the left side of my neck.
And then push my hand backwards. No, I'm sorry, this way, backwards. How about that?
No,
Now, show me how far you take this thumb and bring your arm back behind your back. See how far up your back you can get with the thumb.
that's hurting my left shoulder.
Is that about it? Not very far. Are you right-handed or left-handed?
Both, but I write a lot more with my right.
Okay, see how far you get with this hand, with your thumb behind your back.
It's hurting my right elbow.
Okay.
My lower back.
So is the neck
Yeah, it hurts
all
right
right in there?
there. Yeah. And I noticed also when I was lifting up my head to wash underneath my chin and my neck in the shower,
Right.
the back of my neck felt like it was like a snap. Like something was missing or something was like pinching or something was dislocated or something.
So rotate just gently your head as far as you can to the right. Just looking to your right.
It hurts the left side of my
All
neck.
right, come back to just your neck, not to move your whole body. Just rotate your head. Does that hurt?
Yeah, a little bit. Yeah, right there.
Where do you
Left-
feel it? Over on this side?
Yeah, right up a little bit. Yep, right there. Right up. Yep, right there.
All right, and then come back to neutral and then rotate the other direction. How about that? You can get a lot further that way, can't you? Yeah. Okay, good. All right, and then now how about, can you lean your right shoulder, ear towards your right shoulder like that?
It hurts right there.
In
the back left
on
side.
this side again?
Yeah,
And
but in the middle, in the back left middle.
And then come back to neutral. And then go the opposite way, lean your left ear towards your left shoulder.
It hurts in the same place in the back left side of my neck.
All right, so you can't go too far. All right, and then come back to neutral, and then bring your chin down towards your chest.
It hurts the back left middle of my head, my skull area,
Okay.
right here.
All right, and then bring it back to neutral again, and then try to go back like you're talking about, where you bring your chin up, like you can't really. No, back that way. Can you go very far that way?
That hurts right there.
Yeah. Okay. So you have a lot of muscle tightness all in there, and just like when I was talking to you on one, I know it was the last video visit where you were real tight and all, and I had you do those relaxation exercises, starting with the eyes and the forehead and your jaw, and you just kind of work your way down.
I noticed though, I don't mean to interrupt you. I noticed when I was doing those things, I started getting a really bad pain in the top of my forehead and on the top of my head. From when I was just doing, when you said to just close your eyes slowly like this and breathe, and then open it up slowly and breathe slowly. I started feeling like a really strong, sharp pain in my forehead and on top of my head. I don't know why. I was just closing my eyes and opening my eyes.
So the point is not just to slowly open and close your eyes, but in order to feel when a muscle's tight, you have to purposely tighten them and then slowly relax them, so you understand. Because people will, like, they may have their face all scrunched up and not even realize it. You know, just deep in thought. I've had my wife say, "Why are your brows furrowed?" And I'm thinking, I don't know, I must have been deep in thought about something. And just not even realize it. So, you know, if you do things like raise your eyebrows real high and then slowly relax, you realize, okay, so that's what relaxed feels like. I didn't realize I was tight. Or you clench your jaw and you slowly, completely relax the muscles. So the same thing with the neck. You know, you have very limited range of motion because it's uncomfortable, but you need to be able to stretch those muscles out. So you can go as far as you can until it's uncomfortable, but rather than backing off and coming back to your neutral, just keep it in that position for 10 or 15 seconds, let the muscles relax, and then stretch it a little further. If you do that, you'll start getting more range of motion back. But sometimes you want to do that like right after taking a hot shower when the muscles are really relaxed. And when you finish, sometimes you have to put a cool compress on there to calm it down because you're really tight and you need to get that loosened up. Physical therapists can do a lot more with you, but we got to get you to where you can go see them, because that's like twice a week going to therapy, and that's going to be an exercise in futility if you can't get clean vehicles to take you there.
I think, well, like you mentioned, talk to the therapist about it first and foremost. They'll have that extra documentation. I already reported it to Humana. They opened up the investigation about the unsanitary vehicles, and I guarantee you right now, when I call transportation again in front of you, and you'll witness me tell them I'm requesting a sanitary vehicle that's clean inside and out, and to make sure the driver isn't sick. And if they send an unsanitary vehicle, and God forbid they do, you'll witness that I told them, please don't do that.
Right. So you had that information that Ms. Nolder sent you with the list of the mental health people?
Is it on the
She sent it,
portal?
I think she mailed it and put it on the portal.
I think I received some mail from FSU primarily, but I didn't open it because I'm one of those germ things again. I just didn't want to open any mail. If she sent she did send.
Yeah, because I asked her, I explained to her that we needed to find somebody that could do video visits with you, so you're not constantly missing appointments. So
I don't mean to interrupt. So they would threaten to fire you because I missed an appointment?
No.
So who?
No, we would fire you.
Oh, I didn't know I was fired.
Just like you can fire me if you don't like me, I can fire you as a patient. The policy is if you have 3 missed appointments, they send a warning letter, and then if you miss another one, I say fires, dismiss you from the practice. Because it's not fair to everybody else who can't get an appointment because people are taking up their spots and they're not showing up. But I told them that not to do that, not to dismiss you, just to double book you. So that way, if you don't show up, there's still somebody in your time slot.
And I made sure that, I called to tell them the situation and everything, just so, nobody here would feel like, oh, hey, Omar, he could care less that he has a good doctor at a good doctor's office, you know what I mean? And he's not grateful for the opportunity, you understand?
Right.
And plus, I didn't want to call, I didn't want to have to explain all this to another doctor.
Right. No, I mean, I understand your situation and trying to help you, so it's just the way it is. Unfortunately, it does mean we get behind when you do show up because we have someone else booked in the same time. So we do have to keep moving on. So are you going to be able to open up that letter she sent you and make some phone calls and try to book a video visit?
Yeah, sure. Probably won't open a letter. If it's the same information on the portal, the number to call, I'll just...
Yeah. I mean, it could be.
Yeah, I'm real hesitant to open any mail. I mean, it's just a germ thing again. They literally removed the dumpster that was literally attached to the mailbox area in the brand new construction community that I'm at because I complained. And they have the dumpster all in the far corner of the neighborhood. And that was after, I told them that literally when I was just a foot or two away from the dumpster to throw my garbage away, I started feeling sick.
Right.
And
so now you have to walk all the way to the end to throw your garbage away?
Yeah, but then again, it kind of helped almost everybody in the community because, like for example, around Christmas time, that's when I noticed it the most. I mean, people were obviously probably throwing out all different types of garbage.
Right.
Because, the Christmas time.
Mm-hmm.
But when I was approaching the dumpster, within 1 to 2 feet, I started feeling sick, like I contracted something that was contagious. And I reported
now,
it.
So you could get reactive airway disease when you get close to something like that, but you don't have symptoms from contracting something that fast. See, that's that over exaggeration of the germophobia that you have.
It smelled like a body odor from somebody's lower extremities.
Mm-hmm.
That's what the dumpster smelled like that day.
Yeah.
And it smelled contagious. It smelled
But I understand that. But like when you smell someone's poop, you don't automatically get E. coli in your nose. I mean, you just smell it, and it's because it's full of E. coli. But anyway, so you have to walk a fair ways to dump your garbage now. Do you have like a little wagon you can pull it in so you don't have to carry it the whole way?
But I was trying to see if I could maybe get a referral to like a home health care aide, where at least they could help me, just.
Yeah, we tried that, but the insurance wouldn't cover just a home health aide. I put in the request.
I think if we try it again, it'll help because it's a necessity at this point.
Well, most of the time, the only time you get home health aid is if you also are getting a skilled nurse. And then they'll have the aide come in. And that's things like wound care, when people, had bad injuries or surgery or, foot rot and all those kind of things, and they need help. I mean, I can look at it again, but...
But they gave me a home health care aide before when I got into a car accident years ago.
Actually, didn't somebody come out, but they were nasty or something?
Yeah, but I had to pay out of pocket because I was waiting to get a home health care aide through the insurance company.
Right.
And, I needed them to clean my house and stuff like that because they sent
I'll look at it again, but I can't promise anything. That's usually, sometimes
they'll send it. They'll authorize it because, like, for example, when I was living in West Palm Beach, Florida,
right,
they gave me a referral to a home health aide, and when I was in West Palm Beach, Florida, they just asked me. They said, "Well, pick what home health aid company you want."
You can try. I can try, but I can't guarantee. All right, look, I got to go because I've got 3 other patients I got to see. All right, so you should be able to find that stuff because she did send it on the portal. I'll double check. If not, we'll send it again. But I'm pretty sure I had her send it both by the portal and by mail.
Yes.
To be safe.
But also I need a referral for a nutritionist, occupational therapist, and pain management. And
I'm not sending any of those referrals until you get with mental health because I'm not wasting my time.
Well, what difference is mental health going to make?
Because you're going to miss the appointments because you don't get in the vehicles. That's what I'm trying to explain to you.
Well, what we could do is we'll make an effort and tell them, hey, we're requesting a sanitary vehicle so I don't miss my appointments. And in case they send an unsanitary vehicle, let's schedule the transportation maybe 30 minutes earlier than usual, just in case if we have to send another transportation if the vehicle.
That would be up to you to do all that scheduling. Just trying to get in ahead of time. But
it's not really that big of a deal. It's just what's really most important though is that I need a nutritionist, an occupational therapist, and pain management and a home health aide because I know it'll help.
You're asking a whole lot. I don't know if I can get all that for you.
Well, it's covered through the insurance. I just need a referral. That's what they require. They require just to get a referral.
I understand that, but I'll try. But I'm not promising anything. You say all this stuff is covered by the insurance, but it's not always covered by the insurance.
So what I have to do is I have to call Humana and just tell them and say, hey, I need a nutritionist, an occupational therapist, a pain management doctor, and a home health aide. And they'll send me a list of specialists to choose from and companies to choose from. And then I would call them and ask them if they're accepting new patients. They would say yes. And then I would send that information here.
Right, so you do that, and then when I get the information, you can send it on the portal. Yeah, then we'll put in the referral. I mean, okay. if that really works out, I have no problem doing it, but I'm not as confident as you are that they're going to do all of that.
Well, that's what I had to do before, and they said it's covered. I just need a referral from the primary care physician, and they'll tell me to just send the information and the fax number of the location that I want to go to for those specialists to the primary care physician's office, so they know where to send the referral to.
Right.
So when I find those locations, do I just specifically write on the portal, nutritionist, this is their phone number, fax number?
And we can send a referral. I don't have a problem with that. But you need to make plans to have a backup, if you're getting unsanitary vehicles, so you're not.
Should I call them right now in front of you?
No, because I gotta go. I got too many patients to see.
Thank you, Dr.
Yeah.
And if they tell me again, to try to complain about you or anything, just because they're looking for somebody to blame, I'll make sure I tell you first before I even let that continue, because that's what they're trying to do. They're trying to find somebody to blame for their own fault.
Yeah.
And they're looking for people who are obviously well-established doctors and things like that, so they can have some kind of leverage, in the sense of somebody to blame. So don't let them fool you.
While you're looking for all those other referrals, make sure you look up the mental health one too.
Right.
Like I said, you can do that in the comfort of your home.
Yeah. But the one you recommended though, it's a good one though, right?
Well, there were several on that list, so you could choose yourself, after you make contact with them. But yeah, everybody we have on the list, we should be good.
Okay.
I don't know any of them personally.
Okay. All right. Thank you, Dr. Jordan.
You're welcome.
Yes, sir.
If you want, you can stay in here for a little bit until you get your car, or we can go hang out in the
You've
waiting
reached
room, okay?
FSU Primary Health.
Should I call them in front of you at least so
Medical
you could be a witness?
emergency. Hang
I
up
do have
and dial
to give you a petition
911.
as well,
Okay.
but
If you're calling
call
for
them if you
FSU
have
Senior
any
Health
issues,
or
you can go
FSU
talk to
Telehealth,
them outside
please
and see
hang
if
up
they can help you,
and
okay?
dial 850
It was nice to meet you.
645
Thank you. Same to you.
5050. Please choose from the following options. For general information about our
Thank you for calling Motive Care for your Humana transportation needs.
For English, press 1. Para español, oprima el número 2.
Pour créole, tapez le 3. If you are experiencing a medical emergency, please hang up and dial 911. Calls are monitored and recorded for quality assurance. By continuing this call and speaking to a representative, you consent to the monitoring and recording of your call. You can now use Motive Care's app to schedule trips and manage your upcoming rides. Would you like to receive a text message to download the app? Please say yes or no.
No.
No problem. You can always download the app at a later time. Hello, I'm Mara. I will be helping you today. You will get the option later to set up your voice as your password. This will allow for a faster and more secure validation. I see that you have upcoming trips. Are you calling about those trips?
Yes.
I can confirm, cancel, or change an upcoming trip, help get your driver's ETA, or activate a will call return ride. How may I help you today?
Transportation.
We can now verify you with a text message to your cell phone. Or you can just speak with your voice. Would you like to verify with a text message?
No.
Please say yes or no.
No.
Please provide your date of birth. Please provide your 5-digit zip code. Thanks. You have been verified. Would you now like to set up your voice as your password for future calls?
No.
If so, please. Great. Let's schedule a new reservation for your ride. Am I directly speaking to Omar?
Yes.
What is the date and time of your appointment? For example, May 15th at 2 p.m.
I need to speak to an agent.
Okay, you've asked for an agent, but I'm happy to help you with this request. What is the date and time of your appointment? For example, May 15th at 2 p.m.
I need to speak to an agent.
I understand you want to speak with an agent, but please allow me to finish assisting you with this request. What is the date and time of your appointment? For example,
I need
May
to speak to an
15th at 2
agent.
p.m. I am sorry, you have not provided an input. Please try again.
I need to speak to an agent, please.
Sure, please hold while I transfer you for further assistance. We are available to schedule reservations 8 a.m. to 5 p.m. Monday through Friday. We require 24 business hours notice for all routine reservation requests. Please have your member ID number and the name and the address of the doctor or other healthcare provider you will be seeing. To help improve our services, at the end of the call, please stay on the line to take a brief survey. If you would rather not take the survey, simply hang up after speaking to an agent.